Hello, I'm Dr. Phil Garcia. Today we're going to be talking about a new product, Revanesse Versa. Versa is a product that's been in the market now for a few months, and it is a hyaluronic acid product. And if you recall from our previous videos, hyaluronic acid is one of the chief components of collagen. Hyaluronic acid is a natural molecule that is present within your body, and this product is specifically used to augment the amount of collagen in your body. The specific uses for the product are for fine wrinkles as well as folds. So for example, the product is indicated to be used in fine lines around the mouth, the nasolabial folds, as well as any other creases or folds throughout the face. Today we're going to show you exactly how this product is used on a volunteer patient. Today's patient has what I would consider a very mild problem in the nasolabial fold area. If you look here, she has a little bit of shadowing in the upper nasolabial fold, and she also has a very superficial skin crease. So what we're going to do with our Revanesse Versa product is try to get rid of the shadowing in the upper fold, as well as maybe try to flatten out this skin crease at the bottom here. Okay, so as we said earlier, we're going to be injecting the nasolabial folds as well as these nasolabial creases with our product here, Revanesse Versa. All right, so we're going to start in the upper fold, and the goal here again is to flatten out this shadow in the upper fold. So we prime the syringe, always put a little bit of product into the syringe. And here we go. Staying in the subdermal plane, we push out a little bit of product, and as we're delivering the product, we're withdrawing the needle. This is just my particular technique. And as you can see, we already have caused a little bit of effacement here in the nasolabial fold. So I think that's enough effacement for that upper nasolabial fold. What I'm going to try to do now is inject the skin crease here, see if we can improve this line that she has here. And for this part of it, this is actually a transdermal injection, so we want to be right in the dermis, and this is usually a little more painful for the patient. But if you inject right into that crease many times, you can flatten out that line. Like such. So immediate improvement in that right there. Okay, so this is the right side. I think we've seen a good amount of improvement here, and we've used a little under half of the syringe. So because we want to use the entire syringe, I'm going to come back here and use a little bit more product into this upper fold. And I'm injecting always, when I take care of a fold, I always inject in front of the fold because the goal here is camouflage. So we want things to stand out less in relief. Okay, hold pressure there for me, Jody. All right. So we've already injected the right side here. You see effacement and you see improvement in this right side. And now we're going to go on to the left. Same process here. We're going to try to inject the upper nasolabial fold to try to efface here. And then we're going to come down and try to inject this crease in the lower fold. This is the first component here. And this is a subdermal or deep dermal plane that I am injecting into here. All right, good effacement on that. And then now I'm going to start trying to get that crease. And this is, again, sometimes a little bit difficult to get the needle into the right plane, but once you get into the dermal plane here, you can get pretty dramatic wrinkle effacement. Just like that. Chin back for me. Same thing down here. We're gonna try to efface this as much as we possibly can, and then just go right into the dermis and deliver the product right into the dermis. You can see some of the product coming out of the pore, which is exactly where you need to be here. All right, and let's now come up into the upper fold again with our remaining product, and again, always injecting in front of the fold and injecting as we push out.